Okay, so I'll get started. How many of us? There's around 11 of us, so I'll just get started. And then if anyone else wants to join, they can do afterwards. So today's surgery is on everything about Oxbridge, basically. So whether or not you want to go to Oxbridge, so I'll give you a lot of information about both the universities and what you sort of need to do, because there are a few additional things for Oxbridge compared to other medical schools. Before I go on to that, just to introduce myself for people who haven't been to one of my 6-month surgery sessions before. So my name's Shruti. I'm a 4th year medical student at Bristol University, and and I intercalated in Imperial last year. So if anyone's thinking about applying to either of those universities, I'm happy to answer any questions at the end as well. And then throughout the session, if you do think of any questions, either put it in the Q&A or in the chat, which I'll just check to make sure that everyone can actually access it. Yeah, everyone should be able to access it now. So if you wanted to put any questions and there are any comments, feel free to do that, or in the Q&A section, either or is fine. I'll be looking at both. Okay, so the main things we're going to cover is who are Oxbridge and how is studying in medicine at Oxbridge different to other universities, and also what are the different aspects of applying to Oxbridge compared to other UK universities. And then finally, as I said, Q&A. Now the Q&A can be about the topic that we've done today, but also generally about medicine and why I intercalated, or any other questions that you generally wanted to ask or worried about medicine related. I'm happy to answer that. Okay, so firstly, I'm talking about Oxbridge itself. So it's just the combined term for University of Oxford and University of Cambridge, and both of them are they have like similar ways of applying to it, in that you do the BMAT and then they have a much more specific format of interview as well, which is done slightly differently to other medical schools. And from my memory of Oxford, it's also you do interviews across 2 days. So the interviews, yeah, are slightly different to what you would do for a non-Oxbridge university. So this is just to show where Oxford and Cambridge are. And then moving on to just a bit of facts and information for you about both of the universities. So Oxford founded in 1096, so it's a lot older than many of the universities we have in England. And yeah, so it's the second oldest university in the world. And they have, both Oxford and Cambridge have something called colleges, which I'll go into in a bit more depth in a second. But essentially across the university, you get placed in different colleges for your accommodation. And then that is also related to what kind of degree you do as well. And in terms of world university rankings, Oxford is the first, and in terms of the QS World University Rankings, which is just a different website for all the European universities, it's second. So they're quite well known in terms of research and student satisfaction and opportunities and things like that. In terms of University of Cambridge, that was founded a little bit later, and it's the third oldest university in the world. And similar to Oxford, it also has colleges, and it's 5th in the World University Rankings and 4th in the QS World University Rankings. Just to sort of bring up a point, I just want to say, in terms of for medicine, both universities are equally as good as each other, and I think it's more based on your preference and what sort of things you're looking for in your dream university, or whichever university you want to apply to, because obviously Cambridge might be a lot closer to some people, whereas Oxford will be a lot closer, and there might be a fewer more like personal advantages for you, pushing you towards one university over the other. So just looking at the rankings, it's sort of a good indicator of the education system and how things run, but bear in mind like your own opinion of each of the universities when you go and visit them as well, and don't just stick to the numbers which are on this screen. So just make sure that you actually like the university that you end up applying for, and you feel, because obviously medicine is a 5 to 6 year course, and especially in University of Oxford and Cambridge it's 6 years. Just make sure that you like it enough to be there for 6 years, which is a long time as well when you're doing such a stressful degree. So yeah, I said I was going to talk about the colleges. So there's University of Oxford and there's University of Cambridge. So Oxford has around, I think it's 39 colleges, and Cambridge 31 colleges. And essentially it's sort of people who are in a similar accommodation to you, and these colleges tend to be dotted around the city and around the university campuses. So after you apply for your initial university application, if you do get accepted for interview and then afterwards get given an offer, you do have to choose like colleges as well. So make sure that you have a look into it. I can't give you like specific information about it, but there probably is a little bit more information online about each of the individual colleges as well. Okay. So how is studying medicine at Oxbridge different to other UK universities? So it mainly is the structure of the course. So as I said before, in Oxbridge, you study for 6 years, and it's compulsory to study for those 6 years. And between year 3 and 4, so after year 3, your 4th year is considered your intercalation year. Basically where you do a science degree related to medicine of your choice. The thing with Oxford and Cambridge is you have to do your intercalation in that university, whereas for me, for example, so I'm studying in Bristol, I was able to apply externally to other universities like Imperial as well, so that's something to consider as well. So yeah, we split medicine into preclinical years and clinical years. So in terms of preclinical years, the kind of things you'll probably be learning are your basic anatomy, physiology, and like biology, chemistry, that kind of stuff, and genetics. And you learn about embryology, which a lot of people don't know what that is, but it's like the development of the fetus, and when your cardiovascular system develops, when you start breathing into the amniotic fluid, and when your gastrointestinal system develops. So it's learning about the development of the fetus, and then what kind of cells develop from which part of the body and things like that. And it's really important to learn that, because once you come into your clinical years, a lot of genetic defects and things like that are to do with issues within your embryological development. So it's a good base knowledge to have. Most of first, second, and third year are spent doing lectures. Oxford and Cambridge generally have a very traditional style of mostly being lecture based, so you're taught by different lecturers, but you also have a bit of like lab work. So from my experience of lab work, it's things like physiology labs, where you might go and look at like the oxygen and the carbon dioxide maximum whilst you're doing exercise versus whilst you're at rest, and kind of trying to understand the physiology of how the body works. And then the other thing we had to do was looking at urine samples and like basically predicting what would it be like for a person with diabetes versus a normal healthy individual versus someone with other kidney diseases. So yeah, you learn a lot about simple tests that you'll later on use in clinical practice. Okay, I've got a question. Hi, will you be able to tell us a bit more about Oxbridge colleges, especially will it be more rigorous or supervision for some super competitive colleges? It's a good question. Unfortunately, I can't give you sort of in-depth information because I myself don't know much about it. I think what will be worth doing is maybe looking online, because they do have on their websites individual information about each of the colleges and the kind of support and care you receive whilst you're there. And also I think different colleges have like different dining halls and things like that. So it's more about, I think, staying there and the kind of traditions each of those colleges have rather than the degree itself. So the degree, regardless of what college you're staying in, the degree is not going to change, and what you're learning is not going to change based on what college you're in. So yeah, I try and look online. So sorry, I could not answer that question properly. So yeah, so you get some labs, and then you also do a bit of histology, which is looking at cells under a microscope and learning about normal cells versus pathological cells. So I always think of anatomy as looking at like the big structures, and then histology is looking at those same structures but at a microscopic level. So anatomy and histology always go hand in hand, and then obviously physiology, and then you'll be doing some sort of genetics and cell-based teaching as well, just to get your like basis of biology, chemistry and things like that before you go on to the clinical aspects of things. In second year, you continue to do what you were doing in first year, so it's a similar setup, but in second year you actually end up doing a bit more clinical stuff. So you learn about the pathophysiology of things, so what happens when things go wrong. So in first year you learned about how the heart works normally. In second year and third year you'll probably learn about how the heart works when there's some sort of disease going on with it, so like a heart attack, how does it function after that. So that's the kind of thing you learn in second year, so you learn more about the disease process. And then in third year, it's sort of integrating both of those and learning about the sort of complex aspects of different diseases. And you also start to learn about clinical skills. So what I mean by clinical skills is like how to talk to a patient, what questions to ask them, how to come up with a diagnosis. So you learn the more sort of patient communication skills before. It's in a way to prepare you before you go into your placements, which will be spending all your time in hospital, basically. Between that third and fourth year, as I said, you have a intercalation year. So yeah, just to summarize, mainly lectures, and it will be sort of a self-study as well. You might work in small groups for some small projects, and then you'll have anatomy labs here, and then you can also have like small group seminars and discussions with your personal tutor, and you may have to write like short research papers and things like that, which you'll have a tutor attached to you for that period as well. Yeah, comparing that to non-Oxbridge universities like UCL, King's, Queen Mary's, Imperial, your first and your second years, you do what I basically talked about. But actually in second year, it's a lot more integration into the clinical aspects, because obviously it's a 5-year course rather than a 6-year. So in second year, you actually start learning about quite complex things, whereas in Oxford, it's more of like a, I guess, it's a bit of a slower process before you learn about like the complex pathophysiology of things. Yeah, so you technically do the same thing, except what Oxford and Cambridge doesn't have that these universities do have is something called CBL or PBL. So Oxford and Cambridge do have small group seminars and like reading sessions and things like that, where they learn about a topic and discuss. The contrast to that is we have something called case-based learning and problem-based learning, where you're given a case about a patient and you have to work together in a group of 10 to 11 people, and you diagnose them and figure out what investigations you want to do with them and how to manage that patient. So it's really helping you think about those skills that you will be using as a doctor. So you're inputting that much earlier on in non-Oxbridge universities. And you'll also have a lot more patient contact, which is another difference between Oxbridge and the other universities. So you, for Bristol, for example, if anyone is interested, normally you tend to have clinical placement from the first week that you start university. So you'll either be in GP practice or you'll be in the hospital for a half day a week. So it's usually every Thursday. And you get to see patients and get to see like common diseases that present in both hospital and GP. In non-Oxbridge universities as well, similar to Oxbridge, you do some research as well, and they're called student selected components or student choice, and they're projects which you can pick based on your interests out of a list of the things that the university offers you, and then you do some in-depth research into it, or you work with people to learn more about that disease and then write a short paper on it. And that's just to practice your research skills and your scientific paper writing skills. So that's present in both Oxbridge and the other universities as well. Moving on to the later years, so this BA basically stands for you're doing your between years 1, 2, and 3, which is your preclinical years, and then years 4, 5, and 6. you're doing your intercalated degree. So Oxford and Cambridge, every year they have a specific list of intercalations that they offer, and you basically choose from them, and you do have to apply, but it's sort of an internal application, so you just apply and rank which ones you like, and I think you write like a short summary of why you want to do that degree for the year, and then you would do it. So the kind of degrees that you could do is like clinical sciences, and it's sort of, I guess, encompassing all of the stuff that you learned here, but also bridging the gap to these 3 years later on. So it's more of the clinical aspects of things. So that's the same for Oxford and Cambridge, whereas the difference with non-Oxbridge universities is that you can either intercalate, I think it should say, or maybe it will say in the next slide. So you either intercalate between years 2 and 3, which is offered in UCL, or you can intercalate between years 3 and 4, and that's offered in all other universities. The reason why it's probably better to intercalate between year 3 and year 4 is because you give yourself the opportunity of being able to do a master's. If you intercalate between 2nd and 3rd year, you can only do a bachelor's degree for a year. You can't do a master's. I'm not really too sure why that is, but that's how it is. So if you're intercalating between 2nd and 3rd year, you can only do BSc. But if you have always wanted to do a master's, try and intercalate between 3 and 4. That's my general advice. Okay, so what do you do when you come to clinical medicine? So this is very, very different to what you would do for the first 3 years, or for the first 2 years, depending on the kind of university you're going to. And a lot of people find this change and this jump difficult from preclinical to clinical medicine. Essentially what it is you don't really have lectures. You have some teaching, and you're attached to people called clinical teaching fellows. These are doctors who are really well qualified, who have an interest in teaching, and they teach you basically, rather than you sitting in a lecture theatre and learning from lecturers at university. You spend all of your time 9 to 5 in a hospital. You might have some days where you have online seminars or in-person seminars in your university buildings, but the majority of the time you're spending either, doing the jobs that you would eventually be doing as an F1. So on the top right, like writing notes or taking charge of GP consultations. So in 4th year, for example, in Bristol, we tend to run our own GP clinic, and we see the patient first ourselves, and then we go and present that patient back to the doctors and come up with a management plan, and then we go and discuss the management plan with the patients ourselves. So you develop more and more independence in your practice as you go throughout the years. And then you will also do other things, like in the hospital, for example, where you're examining the patient yourself, and trying to diagnose what's going on, looking at their results, looking at their history, and checking if the examination findings and what happened fits in with the diagnosis that you think it might be. And you're just practicing exactly what you would be doing as a doctor. And you'll be learning about all the different systems, so your heart system, lungs, and you'll be going to different wards to learn about each of these. And you may also be doing some procedures. So what I mean by that is you'll be taking bloods, you'll be measuring people's blood pressure, you'll learn all of these things as you go throughout those clinical years. You'll be learning how to put in catheters, you'll be learning how to put a cannula in, all the hands-on stuff that you need to know by the level of an F1, you will be doing them from years 3 all the way up until year 5, or in the case of Oxbridge, years 4 to 6. And at times you may also have small group seminars or small group teaching as well. Okay, I've got 2 questions. Which one do you think gives you a more detailed understanding of clinical skills needed, Oxbridge or non-Oxbridge structures? It depends, and it also depends on your learning style. So with Oxbridge, I think they go into a lot of depth about like the genetic and the molecular components, which in my opinion, I wouldn't necessarily use them in my daily practice as a doctor, but in terms of research and trying to understand like the disease at a molecular level or a cellular level, it's a really good background to have. So if you think you want to do research in the future, or if you just think you want to have a really solid, good understanding of different diseases, and if that's the way your brain thinks, Oxbridge is probably the right place for you. For non-Oxbridge places, it also depends, because different universities, they're linked to different hospitals which specialise in different things. So in Bristol, we have the Children's Hospital, so there's a massive specialism on paediatrics, and their teaching is particularly really good. So it depends on the type of university you're going to as well. I think in terms of non-Oxbridge universities, they might go into depth for some specialties, but not all of them. But they do give you a better understanding of like how clinical practice runs. But obviously I'm a bit biased because I go to a non-Oxbridge university. So if you spoke to someone who went to Oxbridge, they'd probably say that they learn best in that way. So I think it's about weighing up, you know, how you learn. Do you want to know everything in a lot of depth and have a good understanding of those diseases? Or do you want to know the things you need to know in order to speak to a patient and treat them, but maybe in the future you do want to have some opportunities for research, which is why some people intercalate as well, to gain those additional skills that they may not have spent as much time on because they're in a non-Oxford school versus an Oxford school. So I think it's more the research component which they really drill into you in an Oxbridge university, whereas in a non-Oxbridge university, research not so much, but that's why they give you that opportunity to intercalate to develop those research skills anyway. And that was one of my reasons for intercalating. Just to clarify, you said UCL is only uni based in what? What's that question say? UCL is only uni based London. Which does intercalation from 2 and 3 years? Oh, I see what you mean. It's not the only university that offers intercalation between years 2 and 3. There are some others. I just mentioned it because it was the one on the screen. I'd advise to go and have a look online because I can't remember off the top of my head which universities offer between 2 and 3. Okay, let's move on to the next one. Keep the questions coming if you have anything else as well. Okay. So as I said, yeah, you can intercalate between 2nd and 3rd year or between 3rd and 4th year. Generally, I recommend intercalating after 3rd year, only because you would have at least spent a year in hospital. So, and also you generally have much more knowledge in 3rd year than in 2nd year in order to do that BSc and understand the topics better. But some people do find sort of getting it out of the way in 2nd year easier so they can focus on the clinical years. So again, it's personal preference. Yeah, and as I said, between years 3 and 4, if you intercalate, you can do a master's or a bachelor's, whereas if you only do it between 2nd and 3rd year, you can only do a bachelor's. Okay, and then at the end of your degree, depending on the university you're going to, all these letters look different, but they all mean the same thing. You come up with the same qualification basically. So you can come out with an MBBS, BMBS, or an MBCHB. So MBCHB is the one for Bristol, and for a few others, MBBS is for like things like Imperial, UCL. But the letters, they all mean the same thing. And then yeah, they're just sort of in a different order. Basically, that's how I sort of think of it. Okay, and then in terms of other sort of things you can do at the end of 5th year or at the end of 6th year or at the start of it, your final year, depending on the university you're going to, is you can do an elective. So electives essentially, or research projects, are essentially like a long 2 to 3 months where you have to arrange where your own thing that you want to do or something that you're interested in, and essentially you can spend those 2 to 3 months in a different hospital, whether that's in this country or any other country of your choice, and just learn about an area of medicine that you are particularly interested in, or you want to find out a bit more about, or you definitely know that's what you're going to do in the future and you're helping build your own portfolio. So some people have done it with emergency hospital medicine in London, and some people have done it sort of going to different countries as well and doing emergency medicine or doing pediatrics, so children's care, or lots of people have gone to like Africa and they've done placements in obstetrics and gynae, so in pregnant women and in women with gynecological problems. Or you can do stuff in ethics and law. So this is something that a few people are interested in. They want to understand about the ethics and law surrounding medicine. So with difficult conversations or difficult, what do you call it, difficult situations, what's the moral thing to do, and like learning more about that. So some people want to go into that. Some people want to go into a little bit more sort of research, lab-based work, and some people may want to do a GP. So you can do your placement on literally anything, and your university should have contacts for possible electives that you can contact people and go and do. But in general, if you just search online, there's just a vast amount of things that you can do. I've just sorted out my elective, so I'm doing all in London, and that's just because, you know, cost reasons, but obviously if you've budgeted correctly and stuff, you can go abroad as well for your elective. So there's a lot of exciting things that medicine in general has to offer, whether you're going to an Oxbridge or a non-Oxbridge university. All universities have to do this as part of your degree. And it's a really enjoyable time from what I've heard from people in the year above. Okay, and then you go on to work in the NHS. So I think some of you may already be familiar with this document. So it's a GMC document of what they expect final year medical students to achieve before they become a doctor. And essentially this document is what your curriculum is mostly based on. And it sort of gives you an idea of, you need to be able to do a certain level of research, you need to be able to do a certain level of clinical skills and things like that. So all of your outcomes and your learning objectives are essentially based on what's in this book. So for people who are wondering, like, is one university better than the other? They are all regulated and standardized to some extent, because you, as a doctor, regardless of which university you're from, you still need to have the minimum level competence that is outlined in this book as well. So that's just a bit of reassurance for people who are sort of on the fence about Oxbridge or non-Oxbridge and not really sure whether one's better than the other. All medical universities tend to be really good, and that's because they need to produce sort of a standardized set of good doctors who are able to do all the skills, regardless of which university they're from. Some unique factors, though, about Oxbridge that does set it apart from maybe non-Oxbridge universities are these small group seminars and learning from each other, and which is guided by your personal tutor. And that's something that, if you really like sort of small group discussions, learning about current medical topics and things like that, there is more of a scope for that, because that's as part of your curriculum. You have to do this as well. Obviously, one of the main things that attracts a lot of people to Oxbridge is like the massive halls and the dinners and the tradition of the university. And also, I think there's a lot of things about like new and upcoming research, which obviously is done in Oxford and Cambridge. And then obviously the graduation is a little bit different to other universities. So that is something that might attract you towards it. So how is applying to Oxbridge different to any other university? So there's a reason why it's maybe a little bit more difficult, or there may be a few more hurdles to get into Oxbridge compared to other universities. So with normal universities, you do the UCAT. With Oxbridge, you tend to do the BMAT. So as you can see here, most universities in the UK expect you to have done the UCAT. And there's only a select few which expect you to do the BMAT. Just to clarify that for Keele University and University of Manchester, unless you're an international student, you don't have to do the BMAT, you can just do the UCAT. So that's just a word of caution. But if you want to apply to Brighton, Imperial, Lancaster, or UCL, Cambridge, or Oxford, or Leeds, just remember that you have to do a different examination. So the difference between the UCAT and BMAT, I think most of you would already know. I'll just go over it just in case there are any people who don't really know about UCAT or BMAT. So UCAT is essentially sort of an aptitude test. It tests your knowledge of sort of maths, English, like your ability to reason with and problem solve, just general things. And it's a lot more harder to revise for the UCAT than the BMAT, because the UCAT, you can get a variety of different questions. It's more about working on your technique under timed conditions, and also trying to really understand like how to problem solve. And it's more of a time-based assessment rather than testing your knowledge of what you've learned in A-level. So the sections you have is verbal reasoning, where they give you a massive piece of text and then they ask you questions based on it. Some of you, if you've done the 11 plus or the 12 plus, might have done verbal reasoning before. It's just a little bit harder than when you did it back then. And then There's decision making. So decision making is a section where they give you different problems to solve. So I don't know if some of you have seen like riddles online where it says like John has 5 siblings, Monday, Tuesday, Wednesday, Thursday, what's the 5th sibling's name, or something like that, and there'll be like a weird riddle within that stem. So it's something like that, but then there's a few other different types of questions you can get. You might get some probability questions as well. And then in terms of the next section, will be quantitative reasoning. So that's your basic GCSE level maths that you need to know. The main advice I can give is just being really quick with your mental maths and practicing doing sort of addition, subtraction, multiplication, division easily in your head. If you haven't done maths for a while and you're not doing it as an A level, it's probably worth going over simple problems and remembering how to do percentage changes, increases, decreases, and things like that. And also learning about like taxes and how to calculate taxes and things like that. Can be a bit difficult at first, but once you get your head around it, it's quite an easy section. And then the next one is abstract reasoning, which people find the hardest because you have the least amount of time to do it. And essentially it's like non-verbal reasoning if you've done the 12 plus before, where you get a load of different shapes and you have to find like what the most common pattern is. You only get, I think, about 13 or 14 minutes. I'm not really sure about the exact time, but to do like 60 questions in that time. So people do struggle the most with that section. But once you identify the common patterns, it tends to be quite an easy section after that. So it all just comes with practice, really. You can't really sit and revise for it, but it's just doing lots and lots of questions, which will obviously be a different format of studying compared to what you've done for GCSE and A level. So that can take some getting used to. And then the last one is situational judgment. So situational judgment, they give you different medical scenarios or ethical scenarios, and you have to basically decide what the most appropriate response is. I'd say it's probably the easiest section, and one way to make your life a lot easier for that section to get a band 1 or a band 2, which are the highest bands, is to try and look at the GMC guidance to being a good doctor, which is a free document. You can find it online, and just read that, and basically most of the questions are based on what's said in there. Comparing that to BMAT, it's an in-person written paper, and it's usually done in your school, and it's done on a certain date, and it's usually done after your after you've submitted your medical application. Whereas UCAT, you can do it before. The deadline is usually before you submit your medical application. And you choose for UCAT, you choose the date you want to sit the exam on, and you have to go to a test center. So if any of you have done your driving theory test, it's essentially the same test center where you do that exam in. So with BMAT, what they're testing you on is the first section is sort of aptitude, so similar to questions to what you get in the UCAT. The second section is knowledge of biology, chemistry, physics, and maths. And the third section is an essay section, where they give you 4 different questions to choose from. You pick one question and you have to write a 1-page essay on it. You can't have extra paper, so it's literally just 1 page. So bear that in mind when you're practicing doing those essays. Okay. So panel interviews versus multiple mini interviews. So most universities do give an MMI. In terms of Oxbridge, it's more of a panel interview, and essentially they're split into 2 interviews across 2 days. So the first interview is more like they'll give you a topic and you sort of talk them through a problem solve or discuss that topic with one of those tutors of that college, or the other one. And then the second one is like a panel interview where they ask you specific questions about why you want to do medicine. And the questions with Oxbridge are definitely a little bit more weird than the multiple mini interviews that you normally see in a non-Oxbridge university. And you can get some weird and wacky ones. So ones we've had in the past are things like how many molecules of water are in this glass? And they don't expect you to get the right answer, but what they want to see is your ability to talk through what you're thinking. So I always describe it, whether that's for an MMI or a panel interview, I always describe it as whenever you're doing an interview question, think of it like you're doing a maths question and you're showing out your working. So essentially what you're doing is you're verbalizing your thoughts and talking it through in a structured manner. That's all that you're doing. They just want you to be able to break the problem down and then talk it through so they understand your thought process. Obviously, the university you're applying for will also depend on the predicted grades as well. So Oxford and Cambridge, as you might know, obviously have really high predicted grades. So Cambridge expects 2 A stars and an A, and Oxford expects 1 A star and 2 A's. And then there are some other universities which also expect the same, and then some other universities which just expect 3 A's. So in general, most universities expect 3 A's or above, and then some of the universities expect 1 or 2 A stars depending on the year. Obviously, this information might change year on year as well. So Imperial used to be A star AA, now it's AAA. So they can change year on year depending on the cohort and how things have been in the past year. So that was everything that I wanted to cover today. So any questions from what we've covered? I'll just leave it on this slide. I understand that I probably whizzed through it quite quickly, and I might not be able to fully answer your questions on Oxford, Cambridge, but I can generally answer about medicine. So if anyone has questions on that, happy to answer that now. If not, feel free to go and have a good rest of your day. Grades across the uni, is that the minimum cutoff for average grades? That is the minimum cutoff. You need to get AAA. That's what they offer. And if you get less than, then it's less likely that you're going to get that place. No problem. What if I get an offer and don't get the conditional grades? Then you won't get into that university and you have to reapply next year. So yeah, this is what I try to stress with a lot of other students applying to medicine. Just because you've got an offer but after your interview for that university, that doesn't necessarily already mean you're going to that university unless you have an unconditional offer where they don't care what grade you get, as they still want you, which is very rare for medics. It's very rare to get an unconditional offer. Most offers are conditional. So if you do well in the interview and you get an offer, but then on the day of your A-level results day, you don't get the A-level results that the university is expecting, then you won't get into that university and you'd have to reapply next year. That's why I always stress to people, yes, the interview is important, but the most important thing are probably your grades, because that's what determines whether or not you're going. How are non-Oxbridge interviews different from Oxbridge ones? Well, it depends on the university. So they can either be a multiple mini interview where you have loads of different interviewers who assess you on different questions and different stations, which are based on different themes, basically, which is what most universities are adopting now because it just is a better way of interviewing and it tests a lot of different skills. Traditional panel interviews are still used by some universities where there's 3 or 4 interviewers who will interview and they'll ask you different questions. And usually one of the interviewers is a professor at the university, the other interviewer is a senior doctor, and then the third interviewer will either be a final year medical student or a junior doctor. So sort of not that senior in terms of the clinical level. But in terms of Oxbridge interviews, they're set across 2 days. And the first day will be like a discussion about a topic, and you have to talk through your reasoning. And you may get some weird and wacky questions, which you can look up online. And then the second interview is like that traditional panel interview that I mentioned before, where you just get asked why medicine, what work experience have you done, the typical questions. Is there a certain way to actually answer the Oxbridge questions since they're a bit random? It's more about sort of accepting that you may not get to the right answer, but as long as you give it a good try and you try and answer the question in a logical sequence, and then if they ask you further questions, you're able to answer them without, falling under that pressure. that's what they're testing you on. They're more testing you on your ability to talk through things and explain things rather than actually get to the answer. I think it's just about practicing doing those random questions, but remembering that you can get asked, you know, something completely out of the blue, but what you need to do is not panic and use that same approach for these questions. What unis give unconditional offers, I'm not sure. I think it's also dependent on the person and your personal circumstances. And usually with medicine, they don't give unconditional offers unless in very, very, very exempt circumstances, but I don't know what those circumstances are. But yeah, you'd have to look that online. What's your advice on the 5th UCAS subject choice? That's an interesting one. I always say make a decision on it. Don't leave it blank. I can understand that for most people, if you don't get into medicine, you probably won't take that 5th choice and you would wait a year before reapplying, which is completely fair enough. But I would try and put a related degree. So if I put chemistry down, and they knew that obviously the same personal statement goes to all 5 universities. So they knew I was applying for medicine, but I still got an offer for chemistry at Queen Mary's, regardless of me not really wanting to go there. And it's sort of like a secondary choice, isn't it, to medicine. Some people were quite tactical. They put biomedical sciences. And in some universities like St. George's, for example, there is an opportunity for a small percentage of people to switch from biomedicine to medicine in their 3rd year if they've done well enough to move. So if you want to be tactical like that and you're okay with doing 2 years of biomedical sciences, you can have that as your backup option and then do that as a degree and accept that offer if you don't get into medicine. But if you're definitely sort of hell-bent on medicine, just put a related degree like biology or chemistry or pharmacy or pharmacology, and then see what happens, is what I'd say. Try and do a related degree though. What if I'm younger than 18 when the program starts? Should I still apply for universities with a minimum require? Yeah, so you can only go to uni at 18. So if you're younger than 18, you'd have to wait a year until you turn 18 and then apply for the following year. Should the research, such as an EPQ, be based off clinical or scientific research, or something like the challenges of social care and NHS? Yeah, so I did do an EPQ. I think mine was a bit rogue because I did it on a non-medical topic. I think the argument sort of lies in the middle, really. It depends on what you want out of that EPQ. For me, I wanted it to be sort of a bit of relaxation from stressful A-level subjects, because obviously you do your EPQ in year 30, you start at end of year 12 and finish it in year 13. I think for me, I wanted something to be able to relax. So I did mine on music because I play the piano as well. So it was just a way for me to relax from sort of very heavy subjects that I was doing at A-level. I still was able to talk about it in my personal statement, and I was still able to talk about it in my interview, just because it is my personal interest outside of medicine, and it also showed that I have a good work-life balance. Some of my friends who also applied for medicine in the same year did do what you're suggesting. They did their EPQ on a scientific topic or a medical related topic, and then discussed that in their personal statement. For me, though, I did do a lot of other things outside of that. So I was able to discuss that as part of my work experience or showing my commitment to medicine. And then I just use the EPQ as part of my discussing my hobbies. It really depends on where you want to discuss it. The other tip I'd give for an EPQ is make sure you're actually doing the EPQ because you're passionate about writing it and you're very interested in that topic. Don't just do it because you want it to look good on your CV and you don't really enjoy that topic that much, because it will come through in your exam marks as well. So just do something that you're really passionate about and you're able to talk about it in an essay, which is, I can't remember how many words, like 5,000 words or something, because it's a lot of words and it takes a lot of time. And make sure you're able to balance it alongside your A-levels, and try and not make it work on top of your A-levels. It has to be something which you're happy to do in your free time when you're not revising for other things. So that would be my general advice. Let's say I got an offer in Imperial with the condition of A star AA, but let's say I got AAA, is there no possibility to apply for any other university at all? Well, obviously you won't just be applying for Imperial, you will probably be applying for other universities. And if you're clever enough, you probably would have one university which has very high grade boundaries, so A star AA, like Imperial, and the other universities you apply for will hopefully be AAA. So you're giving yourself a chance of getting into a different university. So you said, I heard something like clearing, but I'm not sure what it is and how to apply. Yeah, clearing it's a bit of a gamble. It's it's a lot of stress and it's not a guaranteed way of getting into university. You call up on the day when you get your exam results where they're accepting for AAA, and then you will have to wait for a very long time, and then there might not be any places for medicine. Usually for medicine, they tend not to have any places. There are some places like St. George's which have previously gone into clearing, but actually last year they didn't go into clearing. So I think a lot of universities aren't really going into clearing for medicine now, but it's a possibility to look online, because obviously you still got good enough grades to get in this year. You just didn't apply to those specific universities, which is completely fair enough, but it is a massive gamble. So yeah, sometimes you can call the universities themselves, so Imperial itself, and ask if there are still places available, but I haven't heard of anyone sort of getting in if they haven't got the conditional offer. How easy is it to select BMAT universities in UCAS when we may not even know how the exam will go, considering the BMAT date? Well, yeah, that's been a problem for years, which loads of students have brought up. I would say you have to be a bit tactical. So people who do the BMAT don't just do the BMAT, they also do the UCAT. And they tend to apply for 2 or 3 BMAT universities, and then the remainder of your choices, they apply for UCAT universities. So to maximize your chances, it's probably a good idea to do 2 BMAT, 2 UCAT, sorry. So 2 BMAT, 2 UCAT universities to maximize your chances. Because obviously with the UCAT, you would know your score. So you're about 50% confident, whereas with BMAT, you don't know your score until afterwards. So yeah, again, it's a bit of a gamble. Is it because Queens do not look at personal statements? I meant for courses other than medicine. Possibly, I don't really know. Or, if you have the predicted grades and you've applied for it, they're probably going to give you it. So yeah. Most voluntary activities must voluntary activities be long-term and continuous? Sometimes I find it hard to find long-term volunteering. No, they don't have to be long-term volunteering. I always say this to everyone. It's not about how long you've been doing something for or the quantity of it, it's the quality of it and what you learn from it. Because no one's going to sit there in your personal statement and look through every single thing you've done for the past 2 years. You need to pick out salient things and talk about those examples. And I've been wondering whether I should participate in short-term opportunities available to me. Yeah, short-term, which gives you a lot more learning opportunities, I think is much better than long-term, because obviously, bearing in mind you're studying for your A-levels as well, you might not be able to commit long-term for a lot of things. If I take a foundation year, will the medical degree still be 6 years or will it be less years? So foundation years are usually Bristol used to do it where you do a foundation year and then it's a 5-year degree. So the number of years of the actual medical degree is still the same. It won't be less for you just because you've done a foundation year. From what I know of Bristol anyway, I'm not sure about other universities. Will applying to lower ranking medical schools be less competitive and easier to get in? I found myself very scared about applying to top ranking schools like Oxbridge and UCL. Different universities mark your application in different ways. So actually, if you have a really good application and you have really good grades and you've done lots of things outside of A-levels and you've consistently done well, applying to Oxbridge probably gives you a good chance, at least to get an interview. And if your personal statement is really strong, it gives you a good chance. However, if you've got because some universities place more importance on your UCAT score than your personal statement, and some universities look more at your predicted grades than your personal statement. So because of the weighting they put on different aspects of your application, actually it's sort of equal leveling because different universities consider different factors more important. I think now they're considering the UCAT and your predicted grades a lot more than they used to. Previously, some universities actually used to look at the personal statement a lot more because it tells them a lot more about the individual and whether or not that type of individual will fit in with the university's sort of ethos. So there is a website which you can look at online on the Medic portal, which tells you like which part of your application they look at more than others for that academic year. So actually it's a difficult question to answer because different universities look at different things. So it's not really that comparable. 4 or more A levels better than 3 for Oxbridge. I think in general, most people who apply for Oxbridge have 4 A levels or 5. I think 4 is sufficient, as in you could do literally biology, chemistry, physics, and maths, for example, or biology, chemistry, another science or maths, and then an EPQ. I know some people who've done literally biology, chemistry, maths, physics, and an EPQ as a final one or a 5th different subject. I don't, because the grades literally say A star AA for Oxford, and then A star A in Cambridge. I think they expect you to get that grade in 2 sciences and then a science or a math for the 3rd one, and it doesn't really matter about the other 2. But obviously if you're doing 5 A levels and you're applying to somewhere like Oxford, you still want to get either an A star or an A in all those subjects, not just in the 3 they want and then get a B in the other ones. I don't specifically know how it works and how they look at grades if you do more than 3 A levels, but I don't think it in any way disadvantages you if you only do 3 A levels for Oxbridge. What's a good UCAT grade for 2024? Really hard to say because no one's done the UCAT yet, so they haven't released the grade boundaries or how well people have done. I'd probably refer you to look at like the 6med website about like, it's got a summary on last year's UCAT scores, which you can use as sort of a rough guide as to how much people might score this year. Is it okay for me to apply to only UCAT scores and not take the BMAT? Yeah, that's absolutely fine. I don't see any problem with that because there's obviously more universities requiring the UCAT than BMAT, unless you really have a passion to go to Oxford or Cambridge or Imperial or one of those other universities which require the BMAT. It doesn't really matter. It's just an exam, and obviously it might be a sensible thing to do because BMAT is like smack bang in the middle of your A levels and possibly your mocks to get your predicted grades sent off to the universities. So it might be quite a lot and quite stressful to take the BMAT as well. So if you don't want to, you don't have to. It's completely up to you. But I would say it's a very sensible decision to do UCAT, definitely. BMAT, it obviously is your preference, but UCAT, it makes sense to do it because so many universities need it. So that was all the questions. Anyone else have anything else? If not, feel free to go. There's nothing else on this presentation that I need to cover. So yeah, and enjoy the rest of your day. No problem, guys. Hope you have a good day. Are there any benefits with applying to Russell Group universities? I think the reason why they're called Russell Group universities is not anything glamorous. It's just that they have a lot more research opportunities than other places. It's not the biggest deal in the world if you don't go to a Russell Group university, because as I said, the only way you can graduate is if you've met all those GMC guidelines. So all the universities who offer medicine, whether they're Russell Group or non-Russell Group, they have to make sure that you're trained enough to have the minimum competence of an F1. So it doesn't really matter. Should medicine personal statements be more humanities style or more academic style? Depends on the university you're applying for, because Oxbridge and things like that, if you look on their application page, they do have like a reading list and things like that, so they might want it to be a little bit more academic than others. In general, I try and have a good balance though. You can make it more academic or than you want to, depending on the university you're applying for, especially if they're research heavy. But remember that the same personal statement is going to all the universities you're applying for. So you want in some level to have a balance of both. So I'd say probably first paragraph, introduction, and why you want to study medicine and what inspired you to do it. And then the next few paragraphs, the majority of your paragraphs should be related to your work experience and your commitment to medicine and your supracurricular activities. And then your last paragraph needs to be like a very, very short paragraph on your hobbies to show your work-life balance, and then one line conclusion. And that's all you need to do. Is going to medical summer school good to talk about on a personal statement for an interview? Yep, if you've developed a lot of skills from that medical summer school, yes, definitely you should. Can medical universities sometimes not reach out? Yeah, well, they're notorious for not being very good at communicating, so it might take a very long time before you find out about offers, usually April, May. The other reason for that is because so many people apply to medicine that it takes them a really long time to get back to everyone, interview everyone, and then get back to everyone. So yeah, it can be difficult. Are there opportunities to attend Oxbridge post-medical school? Attend Oxbridge after medical school, or for specialist training? Oh yeah, of course. You could do masters or PhDs there, so you could take time out of being a doctor and do a degree there. Or you can work there. So you can work there for F1, F2, or for specialty training. Yeah, definitely. Depends on which deanery you apply for in your F1 rotations, but obviously you guys don't have to worry about that now. But there are opportunities to study work there, sorry. Okay, I might end the presentation now just because it's just gone 20 past and there's no more questions left. But I hope everyone found it useful. And I'll probably see you guys in the next surgery, depending on what it is. Yeah. All right, no problem. Hope you have a good rest of your day.